Neck pain, weakness in the arms, difficulty in turning your head. If you have been experiencing these symptoms, maybe you have been told about a need for anterior cervical fusion. What exactly is it? When is it necessary? What are the risks? And most importantly, is it the right choice for you? Today, I'll be explaining everything you need to know about anterior cervical fusion, so you can make an informed decision about your spine health. I'm Dr. Arvind Kulkarni. I'm a consultant at Mumbai Spine Scoliosis and Disc Replacement Center, and I operate at Breach Candy, Bombay, Saifi and HN Reliance hospitals in Mumbai. I've spent years helping patients with spinal conditions, and one of the most common procedures I perform is anterior cervical discectomy and fusion, a surgery which is designed to treat severe neck pain and nerve compression. This procedure can significantly improve pain, mobility, and overall quality of life, but it's important to understand when it's necessary and what to expect before and after the operation. Let's break it down step by step. What is anterior cervical fusion? Anterior cervical fusion, or ACDF, is a procedure used to treat damaged discs in the neck, that is the cervical spine, that are pressing on nerves or the spinal cord. The term anterior means the surgery is performed from the front of the neck. This approach allows surgeons to directly access the damaged disc without disrupting muscles at the back of the spine. The procedure involves removing the damaged disc to relieve pressure on the nerves, placing a bone graft or an artificial spacer filled with bone, which is called a cage, to fill the empty space, and fusing the vertebrae together with a small plate and screws to provide stability. Over time, the vertebrae fuse into a solid, stable structure, reducing pain and improving function. ACDF is not for mild back pain. This can be treated with rest or physical therapy. It's typically recommended when there is severe disc degeneration or herniation causing radiculopathy. If a disc in your neck is worn out, bulging, or is ruptured, it can put pressure on the nerves, causing severe pain, numbness, or weakness in the arms. Or in cervical myelopathy, when there is direct compression of the spinal cord itself. Symptoms can vary, including difficulty in walking, loss of balance, weakness in the hand. If left untreated, this condition can worsen over time and cause permanent damage and paralysis. Again, in failed non-surgical treatments of any reason, this particular condition is indicated. It's also indicated in trauma or fractures of the cervical spine. If an accident or injury has caused instability or fractures in the neck, ACDF may be necessary to restore spinal stability. Not every patient with cervical pain needs fusion surgery, but if your symptoms are affecting your day-to-day life and worsening over a period of time, it may be the best option. Now, what are the benefits of anterior cervical fusion? For the right patient, ACDF can be life-changing. Some of the key benefits include significant pain relief. By removing the damaged disc and relieving nerve pressure, patients often experience immediate relief. Improved mobility and function. Many patients regain lost strength and sensation in the arms and hands. Long-term stability. The fusion prevents further instability or damage in the cervical spine. Minimal scarring. Since the surgery is performed from the front of the neck and the line of incision is in the natural crease of the neck, scarring is small and well hidden in the natural creases. Quick recovery. Many patients return to light activities within a few days and experience full recovery in 2 to 3 months. As with any surgery, anterior cervical fusion does have risks. However, complications are very rare when performed by an experienced surgeon. Difficulty in swallowing, that is dysphagia, which is a temporary sore throat or trouble in swallowing, is unusually seen in ACDF, but usually this resolves in a few days. Hoarseness of voice can happen in a few patients, and this is because surgery is performed near the vocal cords. And again, this reverses back in a few days. And non-union, that is failure of fusion. In rare cases, the vertebrae may not fully fuse. This might need additional treatment, revision surgery, or just monitoring. However, this is more common in smokers. Adjacent segment disease, the fused area doesn't move anymore, so the surrounding disc may wear out faster over time. However, this is mostly theoretical and happens in a very small percentage of patients and may not be symptomatic all the time. Infection or bleeding. As with any surgery, there is a very minor risk of infection, bleeding, or reaction to anesthesia. Most patients recover smoothly without complications, but following post-surgical care instructions is key to a successful recovery. What do you expect during recovery? Recovery after anterior cervical fusion depends on the patient, but here's a general timeline. First few days after surgery, you may experience neck soreness, mild swelling, but will be encouraged to move around as soon as possible. Soft diet is recommended if swallowing becomes a bit uncomfortable. Neck brace may be advised for additional support depending on the case. In the first few weeks, most patients can return to light activities, avoid heavy lifting, sudden movements, or excessive progressive bending. Walking daily is encouraged to prevent stiffness within 2 to 3 weeks. Post-surgery, fusion starts forming and many patients resume normal activities, including work and exercise with their doctor's approval. Physical therapy may be introduced to strengthen the neck muscles as well as the arm muscles. Most patients experience significant pain relief and improvement in function within the first few months. In total, anterior cervical fusion is an effective and proven solution for patients with severe neck pain, nerve compression, and spinal instability. While surgery is always a big decision, the right patient can experience remarkable pain relief, improved mobility, and long-term stability with this surgery. If you or someone you know is considering cervical spine surgery, make sure you consult with an experienced spine specialist to discuss your options. If you find this video helpful, hit the subscribe button and share it with anyone who might benefit. Spine health is essential. Stay informed, stay healthy. See you in the next video.